is loading, going live, and we're live.
Hey, welcome everybody. Zoe, sound check is, can you hear me? All right.
Sounds great.
Okay, great. So I'm going to go ahead and call us to order for our April meeting. So do we have anyone here for privilege of? Second. Okay, do we have anyone here for privilege of the floor?
Anthony Pitts had indicated to speak for Holiday Inn.
Okay.
Right, I sent you that. Did you get the link?
Yes. Okay, so I don't, and Zoe, we don't have anybody in the waiting room.
Nope, I'm monitoring it.
Okay, so if they do show up, if you can just let me know, otherwise I'm going to go ahead and move forward with the agenda. So let's go ahead and take a look at our March 28th minutes. I'm looking for a motion to approve as written. I have a first from Sue, a second from Ravinder. Any discussion or corrections on those? Okay, all in favor of the motion to approve as written, and that's unanimous. Brenda, come back.
Thank you.
And we finally have a financial summary, I think, too, that we've got it in the packet. So I'll turn it over to you.
The financial summary is included. It's, I think I might have done this last month.
You did.
I started to put the notes because they're very brief at the very bottom
Yeah.
of the page. Try to cut down the number of pages. This is through March, so 25% of the year. However, payrolls fall based on when they're paid. So this one only has payrolls through March 18th. So it's not really 25% of payroll. We do have vacancies too. That's also contributing to lower cost. And have been actively recruiting for positions. Feels like month. Recruiting various positions. We have had some success and hired 2 new nurses to start middle of May, and still have 1 vacancy in Rachel's unit, CHS. Revenues do remain low. Some of them do run kind of cyclical. So a larger amount of revenue comes kind of quarterly for environmental health, like when they do the quarters, food permits, et cetera. So it's kind of tough to see. Some of those flu is certainly later in the year. And grants, they often are filed on a quarterly basis. So we are currently, it's still running, it is all running low. And we are in the midst of reviewing our 2022 year-end books. We're waiting for finance to really say that they're complete, but we are doing a review of 2022 to do transfers to make sure our lines kind of balance out to meet finances rules. So that's all I have.
Great, thank you. Sue.
Brenda, I know like 2021, the finances were kind of crazy because it was all these COVID expenses. Do you feel like that's all moved through now and has been accounted for?
We still have COVID grants that we're dealing with. There was the $1 million grant. We have the school grant. We have school grant, I think ends in June. Our fellows grant is actually COVID money, and that goes to June of 24. So we do still have some expenses rolling with related to COVID.
It's like there was a lot of.
They're slowly falling off, right?
Questions? Thank you so much. Let's go ahead and move on to our reports. So Frank is not here because he's traveling on a way to a conference, I believe. Is he on the phone? Oh, he's on the phone. Frank, do you want to do your, hi, Frank, do you want to do your report from the phone?
Sure, yeah, I don't have much to add. My apologies, I'm not there in person. The one thing I did want to let you know is that we had an internal team that met to talk about the agenda packet. And I think we've got some good ideas floating. And I think they align with what Christina, you sent to me that the board had interest in. So we're hopeful in the next probably 2 months, maybe July-ish, we might have something different for you guys to look at. We'll also be reaching out over that time to get more input as we start to make some changes. And Sam can fill you in with more detail if you have additional questions. Other than that, I don't have anything else.
Thank you, Frank. Any questions from board members, comments? So thank you to everyone who provided input on that. I sort of took all the emails I got, summarized them, and sent them to Frank. So that's what he's referring to. Okay, so we'll wait to hear from that. All right, health promotion.
Everyone, Zoe, can you hear me okay from here?
Yes.
As Frank was mentioning, we have been talking about we'll be reaching out to
Sam, you're cutting out now. Sorry.
we've been talking about, shared kind of integrated issues and topics across the department that we would highlight at the beginning of the report, and creating more of a template and considering putting some of the data that we like the Board of Health packet to be a repository for in more of an appendix. So we will have more to share. I wanted to mention that we have a community health worker position open that's on the human resources page. And we're doing some additional promotion to recruit a community health worker to add to our team. And I'm also hoping that next month we'll have more to share related to data around caseload and the needs that we've been addressing through our PITCH program, which is the perinatal and infant community health collaboratives with our health workers. The conference that Frank is traveling to, some of us will be heading there tomorrow, and it's the New York State Public Health Partnership Conference. And with the public health fellows, myself and Shannon Alvord, who's the communications coordinator, we're presenting two presentations. One is called Navigating Public Health Communication Channels to Reach All Corners of our County, which is really talking about all the work that we did during COVID around communications and how we're continuing to leverage those strategies for other public health issues. And then the other is community health workers and public health fellows, a case study in public health training and career pathway development. And that one is part of a panel talking about public health workforce development. So, we're looking forward to it, and it will be a good conference with other New York State partners and local health departments. So I had.
Sam, can you remind me how many community health workers you'll have once you hire this person?
4.
There's 4. Okay.
Yeah.
And then how many public health fellows do you have? Just one?
So we currently have 3.
Okay.
And then we've been in some discussion about bringing on some new fellows. So we've done some initial interviews, and they've applied through the state. And we're in discussion across the different programs about what would be the main projects for them to work on. So hoping that we can bring them on this summer, like June or July.
And the public health fellows are those are time limited positions, whereas the community health workers are regular staff positions.
Yeah, the fellows, I mean, Brenda can say, I think it's through next June 2020.
Yeah, the Public Health Fellows is a grant and they're going to be funded through June of 24.
Okay.
We have 4 applicants that we're looking to bring on. They're all going to be MPH graduates in May. So we're looking at bringing them on, trying to look at really kind of our specific tasks that we're interested in having them do.
The community health workers, the pitch grant is a New York State 5-year grant. So, 2 of them are fully funded under that. And then 2 are, partly funded by the county and partly funded by one of our COVID grants. So,
Congratulations to the staff on those 2 presentations. That's great. Okay, any other questions on health promotion? Great. Dr. Claypack, you're up. Yes.
Meeting on Zoom who are not members of the board. In this past month, since our last meeting, most significant change has been the simplification in COVID vaccine. CDC just
sorry to interrupt you.
is this microphone?
Yeah, just speaks
Okay.
slowly and clearly.
Only the bivalent vaccine may be used. The dosing schedules are simplified. Bivalent vaccine are now approved. Online this month. I go back up to.
Should we turn this off, Sam?
Zoe, can you hear us from here?
Yes, that's much better.
Good, sorry, I thought that microphone was working properly. I just want to emphasize that the bivalent vaccines, which are now the only vaccines that are available and authorized for use, will keep people out of the hospital, prevent them from getting severe COVID to a high percentage, and will help prevent long-term COVID. There are about between 30 and 40% of eligible people who have gotten their bivalent vaccine. And they are missing the opportunity to be protected. So I encourage everyone eligible to obtain their bivalent vaccine. And those of you who have had one, if you are over 65 and it's been 4 months since you got your bivalent vaccine, you may get another one as of being 4 months since the first one. People who are immunocompromised are also eligible, and they additionally should be in conversation with their personal practitioner because their schedule for bivalent vaccines can be tailored to their individual situation. The actions by the FDA and the CDC further confirm the safety of vaccination and are a further statement that it is far more dangerous to be infected with COVID than it is not to be vaccinated, than it is to be vaccinated, I'm sorry. In other words, you're running a risk if you're not vaccinated, and you would be better off being vaccinated. So what do we see for the future? I predict that in the coming year, we'll see even better vaccinations coming along for COVID. This is an evolving strategy, but there is no reason to wait for apple pie in the future when you can have added protection at the present. Very likely that in the fall, there will be the opportunity for COVID vaccination along with flu vaccination. I think that improvements that we've seen in the vaccination program are very natural for what is occurring. We've been the beneficiaries of extremely good vaccines to date, vaccines with a high degree of safety, and we expect to have even better vaccines as we go into the future. A new variant is arising. This is not surprising. This is what we experience with variants in the past. At the current level, it's about 7% nationally. Still, the predominant variant is the XBB.1.5, but this new variant is expected to rise in frequency, and there's every expectation that the bivalent vaccine will help protect against this newest one as well as in all the aspects that I've just outlined. Be glad to, I just wanted to mention one further point, and that is that you're vaccinated, that your risk of hospitalization falls considerably. And you look at who gets hospitalized and who dies of COVID, it's largely the unvaccinated. So that's the most important point to bear in mind. So thank you. Any questions?
Yeah, I mean, I noticed the report this week and it looks like there were, I don't know, maybe 21 positive, 6 in the hospital. Are we seeing, and you mentioned that the deaths that we're seeing in the hospitalizations are those that are not vaccinated. Are you considering people that are under vaccinated in that category?
Certainly, if they haven't received the bivalent vaccine, that's under vaccinated, and they certainly are not adequately protected. Now, the bivalent vaccine has made a significant improvement.
And do we know in the fall, specifically whenever the students are back, are we going to have some type of clinics? Has that been a conversation?
That has not been a conversation that I know of. Rachel might want to comment on that.
Nothing that I've heard yet. Certainly, we can stand up clinics if there's a community need. And that would be along with our emergency preparedness team and Frank and all of that. So we'd wait to hear.
Thank you.
The bivalent vaccine is currently available in pharmacies. and with your personal physician in many cases. So people who need a vaccination, I'd encourage them to reach out to one of those two locations. If you're in university, then inquiring at the health service, what they would recommend would be most appropriate.
Brenda shared our good news already of that we hired a nurse. We do still have one more opening that we're working on filling. Other than that, I don't really have anything more to add to my report.
Any questions for Rachel on the report?
And as Brenda shared earlier, we also hired a nurse that'll start May 15th. I've had one nurse out on medical leave and now I have a second nurse out on medical leave. And we had our highest number of referrals ever, I think, last month. So it's one of those perfect storms, but we're doing okay. Just keeping us really busy.
Thank you. Any other questions for Deb?
Is it reasonable to get a number of referrals this time of year as opposed to more in?
We tend to see referrals drop off in the summer, but then we're pretty steady throughout the year. So we're surprised too. We think it's still kind of catching up from COVID. Last few months have been steadily climbing, and other counties around us experienced that increase in referrals before we did, actually.
Questions or comments? County Attorney, I see you there. Anything from the County Attorney?
I don't know if Bill has anything to say, but I can just give an update. Yesterday, I met with Liz and Skip to discuss what more we can do about the violations of the establishments throughout the county that are selling flavored vapes. What it seems is that the state has these laws, and then we try to enforce them. And then after so many violations, they're supposed to have their license suspended. But when that happens, what Skip has found is he went to one establishment that shouldn't even be operating at all, and went in and said to them, you know, your license is suspended or revoked, whichever one it was. And they pulled out another certificate of registration in a different name. So it seems we're not really getting a lot of follow through and support from the state if they're just going to hand out these certificates of registration in a new name. So, you know, a license can be suspended in one name, but then they continue to operate under a different name. So I'm going to look into some of that, maybe talk to some other counties, see what they're doing with regard to enforcement. We'd like to see if there's something more that we can do at the local level, either through enacting local laws or anything that we can do to hold these establishments more accountable for violating the vape laws.
Holly?
Yep.
Any other questions or comments on this? Okay. Liz? Muted it.
The only thing that I would add is to on the vaping issue is we have been asked to talk with the Health and Human Services Committee about this issue. And so we'll be doing that at I think it's their May 15th meeting. And the only other thing is we held a successful rabies clinic last Saturday, vaccinated 150 cats, dogs, and parrots. That's all. And I think we have.
Yeah, I'm gonna come to them in a minute. Okay, any questions for Liz? Right, let's go ahead and do the CSB report. Harmony, did you have?
I do. It's very brief. Our last meeting, we met with Mosaic. Mosaic is a larger agency that is integrated with Challenge, which people are probably more familiar in Tompkins County. The president and CEO, Alan Connolly, along with Ashley Burke, the clinical and business operations vice president, met with the board to talk about a new marijuana dispensary that they have received a license to operate in Tompkins County, and it will be someplace in Ithaca. They did not have the site yet available to the public, so they did not share that. They look at this as an opportunity to provide competitive jobs with benefits to employees, and to use the profits from this operation as a means to support their other vocational services in the community. They also have what's called an Article 16 clinic that they have expanded out in Challenge's location over by Ithaca College, and that provides vocational and rehabilitative counseling services and Master of Social Work counseling services to people who are receive services to the Office of People with Developmental Disabilities. So that was the primary focus of our time. Are there any questions?
Harmony, any questions from board members on this? Harmony. All right, we'll move to new business, which is our enforcement actions. And we do have the individual who is here for privilege of the floor, Cassidy, I think from Holiday Inn.
Yeah, this is actually Anthony.
Oh, hi, Anthony. You're showing us your show is Cassidy on our screen.
Yeah, I'm on Cassidy's computer because I don't.
Okay.
Yeah.
That's okay. So we'll go ahead and move you now to go ahead and address the board. So we generally provide 3 minutes for the privilege of the floor. So it's yours.
Okay, so why I'm here is the pool at the Holiday Inn Express was it was inspected by McCall March 2022. It was low on chlorine, so he had me shut it down, get it where it needed to be. I'm not 100% sure, but I was under the circumstances that once the levels got back to where they were, that I could reopen it, not knowing that he was going to come back. But I didn't see him until November of 2022, which when he came back, he implied that the pool should have been shut down since March 2022 to November 2022. So that's why I'm here, because there was a just confusion on my part, not knowing that I didn't see him for those 6-7 months. I didn't realize that the pool had to be closed. I do have all of the records and all of my paperwork that the levels were fine, but it was just that he wasn't it wasn't supposed to be open, which it was. And so when he came back in November, he said something. Well, I actually didn't really know that it was closed, honestly, because I didn't get anything, emails or anything, and I didn't see him for the 6 months, 7 months. So then we got the letters in the mail about why we were closed and everything. And so we did pay, offered to pay the $400 fine. So that's why I'm here. And he did come back December 2022. It was reopened. All the levels were fine. And we've been keeping up with sending the daily, monthly reports to you guys. So yeah.
Thank you, Anthony. Are there any questions from board members on this? Okay. Thanks, Anthony.
You're welcome. Thank you.
Yep. Okay, so let's go ahead and look at the enforcement action now. So this is resolution number 1 related to the Holiday Inn Express. So if we could get a motion to approve as written, we have a first from Shauna, a second from Melissa. So Liz, could you talk us through this? Please?
Yes, this, as Anthony indicated, there were a couple of inspections done and the chlorine was not operational. There were some equipment issues. So that as it is noted on the inspection report from March 10th, the pool is to be closed until if the chlorine level is fixed or disinfection level is fixed and TCHD approves it. So it is noted on the inspection report. So there is a proposed penalty of $400, providing the monthly logs, operating logs, and providing the proof of repair of the pool's acid feeder in the enforcement.
And I
No, sorry, Anthony.
so yeah, I wanted to
Anthony, sorry. Yeah. You asked her he has to stand mute. Okay, go ahead.
It was done.
Okay, questions for Liz? Okay, so can you walk me through this? So the inspection report where it says that is the inspection report, the December 19th inspection?
No, it's the let me see, February 20.
So I think we don't. Do we not have that one?
We have one dated February 15th.
There should be one in the packet dated March 10th.
Oh, I have, okay.
Yeah.
Right, and under the
Oh,
public
yes,
health
right
hazard,
there.
last sentence says operator closed pool until minimum disinfection is established and rechecked by TCHD staff. Are we notified? Come back.
Okay, and so the gap between March and December is because nobody notified you to come back?
Correct. Thought it was closed.
Questions? Yes, Sue.
Do you think it was clear that the Holiday Inn was supposed to notify you as opposed to you guys coming back to them?
We don't go back to any operator who has a problem until we know that it's fixed. Right, so normally the operators are contacting us and saying this has been corrected when they're closed.
Right.
When they're closed. So if not, how would we know to go back out there?
Mm-hmm.
Any other questions?
And this report, the summary report, did they receive a copy as well? So he had access to the information that he was supposed to be closed and in fact have the department reopen.
He signed the March 10th operating report. Signature.
Other questions from board members? Yes, Sue.
So the other issue was the filters that weren't working. I'm looking to see that those were repaired. The filter feeder, what was it?
I don't know all of the details. I know they were having operational and some equipment issues that it had, wasn't a one-time thing. I'm not,
So it looked like there was filters at one point, and then there was also the chlorine. And then there was also chlorine. So different things at different times.
so the main thing that wasn't resolved is shown in the draft resolution about repairing the pool's acid feeder and flow meter. The other things appears to be are more operational issues at this time.
How do they submit logs to you? Is that online where they just enter
It's
the
not,
data?
it's not online. They submit a report to us
Okay.
by either email or
And how?
Regular
frequently
mail.
Do they do that?
monthly.
Okay. And that wasn't happening between March and December.
I would have to go back and check to see when things were submitted. I do know they have submitted them recently.
Any other questions from board members? Okay. So all in favor of the motion to approve as written? One opposed? And abstentions. I think that was unanimous. Okay, thank you. And I think we have covered everything on the agenda because there was an administrative item, but that got removed, correct? So we are adjourned then until okay. Everybody, we'll see everybody next month. Yep.
Bye.